Now, Susan, you've talked about the worst case scenario. Can you tell us about the best case scenario?
Yes, and fortunately there is a flip side. From the same clinical research that we learned what predicted negative clinical outcome, we now know what predicts positive clinical outcome. And that is that at the end of a session, if the patient has high commitment strength towards the treatment plan or the change, they're more likely to follow through. Well, as practitioners, we can actually influence that commitment strength. It was found that the more that the practitioner could evoke what we call change talk from the patient during the session, the more likely they were to have high commitment strength and follow through. So what we mean by change talk is getting the patient to talk about their desire to change, ability, reasons, and need for change, even some of the steps that they've already been taking. And the more that the patient talks about this, the more that, again, we can be assured of having them follow through.
But how does that work? Just talking about wanting to change can be effective?
You know, there is something very powerful about what we say to someone, how we own it, and then there's techniques where we actually can reflect back the change talk, either in a brief reflection or in a summary at the end. That's very empowering for the patient. All too often, they don't have the freedom to have someone formally and systematically, with no judgment, help them kind of sift through their ambivalence and come up with the reasons to change, what's in it for them, and to help reinforce that.
And I'm thinking about a lot of this is just getting out of people's heads and hearts what they're thinking and feeling about, and doing that in an environment with somebody you feel comfortable with, a trust, a healthcare professional or other, can be very powerful. And making a commitment to it. We know from a lot of research in social psychology that just making a verbal commitment, whether it's starting a quit plan for smoking or whatever, that can be powerful. So it seems like motivational interviewing is really bringing together some of that research and some of those approaches into a structured, directive approach, client-centered approach to addressing these issues.
Absolutely, and I really do think that as a psychologist, you know that there are certain innate human qualities, and by kind of accepting those and using those in a way that has integrity, that respects the choices that people have, their resistance to being told what to do, and also learning what really does motivate them by leveraging what we know about psychology. I don't have to be a counselor or psychologist to use that in my practice.
So you're working with a patient and they tell you, I don't want to make any health-related changes. I don't want to stop smoking. I don't want to take my medication. I'm fed up with it. I'm overwhelmed. I've heard this over and over, all the things I need to do. My wife's told me to do these things, my doctor, everybody.
Sure.
From an MI perspective, how do you respond to that?
Well, what I hear first of all is the experiences and the negative experiences that they've had in the healthcare community. Very clearly that comes through. They're fed up, they're tired of it, they're tired of being told what they should be doing. That could be pretty daunting after a while. So the very first thing I'm going to do is to truly listen and validate. Generally when that happens, the majority of people, the majority of time, we find that at that point they do show their ambivalence. You know, people feel two ways about things. But if someone is, if for smoking example, if I know I should give up smoking because of health, everyone knows what they should be doing. But on the other hand, it really does help me cope with my stress. How else can I change my mood state in 7 seconds? If the healthcare community is constantly nagging on me on this one side of my ambivalence, I'm going to defend the other side. So it's a very rare experience to talk to a healthcare provider and have them understand the role that smoking plays with stress and to validate that. Something almost, I call it magical, but something happens is instead of having a resistant patient, I have someone that for the first time has been validated and now feels comfortable going themselves to the other side, saying what I would have liked to have said but resisted. Now they say, but you know, I really should give up smoking because XYZ.
Giving their own reasons for change.
Exactly.